We are now in a global pandemic.
This is an extremely dangerous event that we are facing.
Western Washington is the epicenter of the coronavirus pandemic that's sweeping the nation, with more than 1,000 residents infected and a death toll that's rising daily.
All the systems are overwhelmed right now.
New rules meant to slow the spread of COVID-19 have our region reeling. And it's not just schools, sports, and businesses feeling the pain.
There's not a lot of brain space in this moment for people to be inspired by philanthropy.
What resources can you tap to get through this crisis?
There are a lot of families around the city that have to work.
Our panel of experts weighs in.
It's an entirely different virus than influenza.
If people need help, please reach out for help.
Countering coronavirus, next on City Inside Out. Welcome to this edition of City Inside Out. I'm your host, Brian Callanan. In Seattle, as in cities around the world, local leaders are struggling with a coronavirus crisis that's affecting public health, our economy, and just about every other aspect of civic life. This week, we're focusing on the local response to this rapidly changing pandemic in the middle of March, as our community braces itself for a situation that's going to be a lot more challenging before it gets any easier.
According to the World Health Organization, we are now in a global pandemic.
In an effort to stop the fear that can spread faster than the coronavirus pandemic itself, leaders across Washington state have been taking action.
Today I'm announcing steps to help communities contain COVID-19.
In what is now a national state of emergency, our state has shut down schools and promoted telelearning. Gatherings of more than 10 people are banned. Plus, our state is working to ramp up processing for coronavirus tests to several thousand per day.
Testing will become more available, though I will say testing kits are still in short supply.
Teresita Batayola is president and CEO of International Community Health Services. This nonprofit served more than 32,000 people last year across a system of 11 locations. Now, it's dealing with a worldwide pandemic that's challenging its limited resources.
The thing is, there is no cure right now, so it's not as if we could just write a prescription for people.
One top issue, ICHS says many of its patients with chronic conditions are not coming in for needed treatment due to COVID-19 concerns.
So we're trying to figure out different ways of providing the services.
Plus, ICHS is battling against a powerful anti-Asian stigma, as many, including President Trump, have connected coronavirus with race, ethnicity, or nationality.
We know that viruses do not discriminate. It has to stop. It does not help a public health crisis for discrimination and racism to be the order of the day.
The silent streets outside ICHS in Seattle mask a reality of frenetic activity for Jody Waits of Youth Care.
We are one of dozens of organizations in town who had to face a really hard decision around our annual fundraising luncheon.
When I was ready, Youth Care helped me take back my future.
Youth Care, a nonprofit working to end youth homelessness by providing shelter, food, education, and training, had to cancel its once-a-year spring fundraiser, an event that raised more than $800,000 last year.
There's not a lot of brain space in this moment for people to be inspired by philanthropy. People absolutely need to concentrate on health, safety, and family right now.
Youth Care is focused on the safety of the 1,600 12 to 25-year-olds it serves every year, and its 200-plus staff members.
Our ultimate balance is how do we stay mission critical and keep our team safe.
And while Youth Care has rescheduled its luncheon to this fall in the hopes of recouping its losses, Waits is well aware the threat of coronavirus is constantly changing.
It's a leap of faith no matter what, even though October feels like it should provide enough distance and safety. We don't really know.
Whatever plan you had yesterday is no longer valid for today, so you have to be very nimble and ready to react.
That's Milan Uzalak, who spoke to the Seattle Channel when business was down 90% at his 2120 restaurant downtown, just days before the state closed all bars and restaurants.
It's a massive impact.
In mid-March, Amazon pledged $5 million to support small businesses like 2120 in its immediate neighborhood, and has provided Uzelac with free rent through the month of April.
They do actually care about their partners, and they're putting their money where their mouth is.
Workers will be able to receive unemployment benefits.
That boost from Amazon, plus a fast track for unemployment help from the state, and a business relief package from the city, should help in the short term. But Uzelac says the long-term impact of coronavirus is still an unknown.
The common rule of thumb is that 70% of the economy is run on small businesses. So, I mean, that's a huge chunk, and we're all being affected.
With all of us, businesses, health providers, and so many others caught up now in this worldwide public health crisis, it's a challenge to stop coronavirus from claiming hope as a victim.
There is a great deal of true caution about what the future brings.
We have to uplift each other.
We're not going to let this just absolutely crush us. It's going to be, we'll get some bumps and bruises, but we'll get through it.
And we are recording this show on March 19th, and I should point out that measures like social distancing, I'll show you a wide shot of the set right now. This is the order of the day here, and I thanks to our guests for being here as we talk about this. We're talking about the closure of schools, we're talking about the closure of restaurants, just to name a few things in this very fluid situation. I want to make sure I introduce our guests who are here right now. First off, Denise Juneau, she is superintendent of Seattle Public Schools. Denise, good to have you here.
Yeah, thank you.
We also have with us Miguel Maestas. He is Housing and Economic Development Director of El Centro de la Raza. Good to have you too.
Thank you.
And finally, we have Dr. Anne-Marie Kimball. She's joining us on the phone. She is Professor Emerita, University of Washington School of Public Health, also the founder of the Asian Pacific Economic Corporation Emerging Infections Network. Dr. Kimball, good to have you too.
Oh, thank you. It's a pleasure to be here.
Great. I want to talk about the response to this in a little bit, but first I want to try to talk about impact. Can you try to put into words, Denise, what the last few weeks have been like for you and the people you serve? A very, very difficult decision to shut down our school system.
Yeah, I mean, the decision to shut down schools is huge because we know our economic impact. Like when schools are out for a snow day, everything shuts down. And so the decision to close down for an extended amount of time was really weighty and heavy. We also know that there are a lot of families around the city that have to work, and by having their children home, it puts an undue burden, and I think we're seeing that play out across the city as well. And just all the structures of public education and how are we going to rebuild in a way that provides a more remote system that we're not used to providing. And so just a lot of thought. What I will say is the regional superintendents have been talking very frequently, so these decisions were not made in a vacuum. There's a lot of conversation about what everybody's doing together so that we can create a more coordinated response.
Okay, thank you for that. Miguel, El Centro is such a vibrant place. I have visited that Beacon Hill location many times, but now you've had to tell staff to stay at home, public meetings canceled. 300 people live on that campus area. You have small business spaces too. What's the impact been for El Centro so far?
Well, it has been a huge shift for us. Obviously, as a nonprofit and a community-based organization that works to really build community and empower people. We've worked for years directly with people, bringing people together, working one-on-one. So having to do a shift where we basically closed our historic building is a huge shift for us. But we've actually continued to be responsive to the community. We've gone through a structural change where even though the building's closed, we're continuing to provide services remotely to families. So everyone is still working, which is great. We're calling and checking in on our participants. So people that are working remotely now are calling participants, checking in on them, seeing how they're doing, making sure that they're connected to any services that they need. Okay. Whether it be, now we're seeing the need for and making sure people know resources for food assistance, for health, for connections to insurance or referrals, for rent and utilities, for and signing up for unemployment benefits or Social Security. So a lot of it is now making sure people have those resources, and we've maintained some essential functions on the campus.
Okay.
So,
and I'm going to break some of those down in just a little bit, but thank you for talking about that with me. Dr. Kimball, there have been huge impacts on healthcare too. Recent tests have shown dozens of local health workers have been infected with coronavirus, and I wanted to talk about this, a strain, a big impact on our medical system as the caseload continues to grow here. Are we prepared for this from a healthcare perspective? Please talk about that to start, if you would.
Well, sure. I think that we've learned from watching Italy especially, but also China before that, that this will create a large stress and is creating a stress on our hospital system. From listening to the conversation in the healthcare side to date, that stress is exacerbated by a lack of access to personal protective equipment. So it's not just beds. People count beds and say, oh, well, this many people can have beds, and then we don't have any more beds. I think that's not what's going on right now. What I'm hearing is concern about personal protective equipment so that your providers, especially in emergency rooms, but generally in the hospital taking care of people, or in doctors' offices that are fielding people, can be protected themselves, and that's absolutely critical.
Yeah.
I understand a lot of appeals have been made for donated equipment here on Bainbridge, and then I heard the mayor today say she was going to ask doctors' offices, which were closed, to donate that equipment.
I see.
And I think the other part of it that people don't always understand is how stressful this is on the healthcare workforce themselves.
Sure.
People are working long hours, and it's incredibly stressful work, and they're understaffed. But here's another piece of that. We do have a retired physicians corps, retired providers corps in Washington State, but as you know, people over 60 are supposed to stay home. So you have a conundrum there.
I see. Thank you for that. And we're going to rely on your expertise a little bit more later in the show, but I appreciate those pieces to start with. Superintendent Juneau, in terms of how schools are responding, you've got about 54,000 kids in the K-12 system here in Seattle trying to keep up on their classes. I know you're working on some telelearning options, but I know not every kid has a computer at home or access to the internet. We have homeless kids too. What are you doing?
Yeah, and I mean, in a city this large with these many students and families, and it is a very diverse system, that there are students that don't have technology at home or internet at home. Also, the flip side of online learning is it is a specialized skill for educators.
Yeah.
You can't just flip the switch and all of a sudden teachers are online teachers, right? We have a mode of education that is classroom-based, it's personal, it's relational, it's in person, and so it is, to flip it around that quickly, it just doesn't happen. Now, we may be able to look forward to some training with teachers, some access at home, but for equity reasons, for professional reasons, we weren't able to change on a dime to be able to provide that type of modality of learning. But we are working on all kinds of supplemental learning that can happen in homes, that we will provide guidelines of what could be what your day looks like at home.
Your TV channel?
We have a TV channel. We'll be broadcasting out great teachers doing great lessons, and so we will be providing information in that way, but it's going to take a while for us to build a system that's actually equitable and can reach out to every home.
Right, and reach out to every grade level too. I know that's a big piece of it. Miguel, more than 100 kids living in El Centro's building there in the Beacon Hill area. Do they have computers? How are you helping out families with this piece? The schooling part is very important.
Yeah, that's actually a great question. We actually have somewhat of a successful partnership that came together just in the last few days, in which we applied to a grant that we were informed about from the folks at the Community Technology here at the City of Seattle.
Yes, right.
Delia Burke, and just got word that FS Global Good Project funded us so that we could purchase 66 laptops for kids that we work with in the after-school program that we've been working with, that are in the community and at the apartments there at Plaza Roberto Maestas. So we also are partnering with Comcast so that we can get those computers available, low cost, and that their families can have access to internet. So actually, we'd love if anyone's interested in supporting that for $150. If somebody's willing to make a donation, we can get a laptop and help a family get internet connectivity so that and support their learning during this time.
Right. It's a very direct connection now for those students. Dr. Kimball, I wanted to talk about hospitals in our region. I know they now have some drive-through testing areas, but not everyone has been able to access a coronavirus test. I personally get a little frustrated when I hear that pro athletes are getting tested, but healthcare workers are sometimes struggling to make that happen. Bottom line for me, from what I'm seeing, it doesn't seem like we have enough testing capacity in our healthcare system. Is that true?
Oh, that's absolutely true. We don't have enough capacity. We started out very slow with about 3,500 about 5 days ago, and now in the entire state of Washington, according to the Department of Health, we've done a little over 17,000 tests. And that's really, really a drop in the bucket. Also, testing is being confined to people who have symptoms, and the test is ordered through their doctor or doctors and first responders and nurses themselves who need to be tested. So it's really not the kind of program that we need. We need much broader testing. We probably need a random sample to understand how far the virus has gone in the population. But all of that, is not happening, and it would be a great guide to understand where we are with the epidemic.
Yeah, and you've written about this for many years, just in terms of how these different systems are funded. Is that part of the issue here, Doctor?
I don't think it's. I think what you're seeing here is just a slow gear up at the federal level, frankly. And I think you heard the Fed say, yes, this was a failing, and it has been a failing. And so now I think things will loosen up and begin to move forward quickly. Okay, thank you. And we're going to talk a little bit more about numbers in a bit, but Superintendent Juneau, you have more than 17,000 kids who qualify for free and reduced cost meals in Seattle schools. This is a critical service. Tell us how you're taking care of these kids and families.
Sure. That was priority number one when we had to do the closures. We had to make sure that basic needs and essential services were happening for our students and families across the city. And so we now have 26 food sites set up across the city, where people can come from 11 to 1. That map is on our website. So they can come and get lunch. We are now, some places are putting a breakfast in there as well for the next day. We still have the backpack brigade, which is going to provide thousands of lunches or dinners and weekend backpacks to our students. So that will kick off tomorrow. We actually are doing a dry run of bus transportation to bus stops across the city, so we may be able to engage our yellow school buses in delivery of meals. So we'll see how that works out. And if that does, then we can scale that up for the city. We have great partnerships. So the Alliance for Education and Amazon have teamed together and got out grocery cards to families in our system. And so just a lot of people that are calling in, supporting our families, making sure our students are fed, and we will continue offering those services. And making sure that people know how to access that through the web. That's important to know all around the city there. Miguel, I know there's been a lot of concern from people who are out of work right now about paying the rent, paying the mortgage. I know that Seattle, the city of Seattle, has an emergency moratorium in place right now to prevent residential eviction, but what are you telling the 300 people who live in El Centro's housing?
What we're first letting people know that we are working very hard to take care of everybody, that there's not a risk of people being evicted, that and really working with families to connect them with the services that they need, to make sure that that we're working with families that do need help, not only with rent assistance but food or other things, help with utilities, not only at the apartments. At our site, but with the families across the community that are facing this situation, and making sure that we have benefit navigators that are helping people connect with services, and just letting people know that really we're going to continue to work as hard as we can to support people and help families as much as possible, so that we can all get through this together as a community.
Yeah, it's such an isolating disease. That outreach is a critical part of this, of course. Dr. Kimball, back to you. You've dealt with several pandemics in your career. What are you expecting to see in the weeks ahead when it comes to new confirmed cases? I know we're seeing a lot more of those. How does this compare to other outbreaks of disease you've studied? What should people know about this when we see these numbers go up? What does that mean?
Well, every every epidemic has a curve.
Mm-hmm.
That's the first principle we work under, and so it goes up and eventually it comes down.
Yeah.
We hope. It
Yes.
can also become endemic, which means we have sort of a low level of infection that's constant in the population.
Yeah.
But given what we know about this virus, we really haven't got a perspective on whether we are looking at weeks or months. And I can tell you personally, we're all hoping for weeks.
Yeah.
When you start to see a bend in that curve, and that's why we're doing all the social distancing.
Yes.
Other epidemics such as SARS, we didn't actually have SARS throughout a calendar year, so we don't know if coronaviruses in general are seasonal.
Yeah.
The other coronavirus is the Middle Eastern coronavirus, and that's on the Arabian Peninsula. And, of course, those seasons are entirely different, and that situation, while it continues, has never spread internationally to any great extent. So this is a unique experience. I would hope it would be seasonal, but, we just don't have any guarantees. We have absolutely no knowledge. It's an entirely different virus than influenza,
Right.
which,
right.
of course, is highly seasonal.
That's right. The part of it that really, I think, throws a lot of people into a panic, doctors, you see these numbers jump up. I think that's a function of more people getting tested. Can you break down, in terms of this rise in cases that everybody's concerned about right now, can you break down what's happening there?
Well, I think a lot of it is the rise in testing.
Yeah.
We just, as we just discussed, we have a lot more testing going on in the state than we had previously.
Mm-hmm.
Our mortality rate has, the number of deaths
Yes.
has also gone up, but more slowly, I think, than the curve has.
Right.
So that's some indication that we might be seeing a testing artifact as opposed to an actual increase in cases. The other thing that's troubling is that we're starting to hear that people without any symptoms can actually be carrying and transmitting coronavirus.
Yeah.
And that is been reported by a number of studies and
Yes.
modelers. And so if that's the case, you would really want broad testing, because those would be the people you would want most to practice social distancing.
Yeah.
But as it is now, we are all practicing it because we are on the upswing in our curve, although we don't look like we're going up as fast as New York did.
Right. No, a lot still ahead. And social distancing, we're doing it right here on the set here. So thank you for bringing up that piece. Superintendent Juneau, I want to talk about this because so many parents are concerned about it. Are you optimistic Seattle schools will come back online before the fall of this year? You got families worried, is my student going to graduate? Will they have to repeat a year? Do you extend the school year past the month of June, or what can you tell us?
Well, I guess what I would first say is that we are working with the state education agency, we are working with the governor's office, we are working with the state legislature on all of these issues. We know that any loss of instruction is not a great thing to be in, but in this crisis, we're all going to just have to provide some patience. I am optimistic that those will all get figured out. We will look towards a more robust summer school, maybe, probably not for everybody, but and just try to figure out how we're going to best approach the future. We are working really closely now, particularly focusing on graduating seniors this year.
Yes.
We want them to graduate. We want them to get that diploma. And so working really closely with the state on what does that look like. And then, of course, the rest of the high school students what's going to happen with their credits. I mean, all these issues are top of mind for us as we continue to figure out and build a system of supports for all of our students across the city.
And I know it's a very fluid situation.
Very fluid. It changes minute by minute.
Yeah,
sometimes,
thank you for breaking down what you're going into right now. Miguel, we saw in our setup piece that a number of nonprofits are hurting right now when it comes to fundraising, supplying services. How do you continue to provide at El Centro, provide and pay for services like food banks, helping out seniors, things of that nature? Do you apply for grants, or what do you do?
Well, we have been applying for assistance and applying for more grants to continue to be able to serve people as we continue to move through this crisis. So actually, every little bit helps.
Dr. Kimball, I want to talk about the measures that have been taken so far to prevent the spread of coronavirus. We've been talking about social distancing, closing restaurants, restricting travel over the border to Canada. That broke down just a couple days ago. Have these been appropriate measures? Do we need to go further? Let us know about that, please.
Well, what we know from China and what we know from other economies like Singapore and Hong Kong is you can get a handle on this with social distancing. The Chinese used quite severe, I guess I would say,
Yeah.
lockdown. I mean, they had people who were literally quarantined in their homes for 6 weeks.
Yeah.
We're hoping we're not seeing that. There were a lot of other things that have been used, such as requiring documentation for people found on the streets. You know, in terms of why are you away from your home, you need to go back home.
Yeah.
That was certainly the case in Singapore. So you're seeing a variety of things, and I think what we're practicing here is sort of level 2, if you will, of
Yeah.
a 4-level thing,
Okay.
and working it through. I think it's appropriate in that we want to keep people from being in close contact with one another, so the 4 to 6 foot social distancing. Restaurants, concerts, etc.,
Yeah.
are all venues which are very crowded, and we have documentation that causes transmission.
Right.
So I think they're all appropriate. They may not be completely adequate
Yeah.
to what we need, but I think we're assessing every day.
That's right. Thank you very much for that, Doctor. We need to start wrapping up here. Miguel, I'll start with you on this question. Last piece of advice for everyone, clearly very concerned about this as we get into the next stages of this pandemic.
Well, I think if people need help, please reach out for help. People can call us at El Centro de la Raza at 206-957-4605. And also for everyone, I think one of the things that we will continue to have to work together as an entire community is to make sure that people don't become isolated. And it's incredibly difficult as we have to practice social distancing, but isolation can be very difficult for individuals, and we're reaching out to people that we work with in our community, but asking, please reach out to friends, to loved ones, to people in your community, and support one another as much as we can.
Thank you very much for that. Dr. Kimball, any thoughts here? Some advice, maybe encouragement in this difficult time. There's a lot to consider.
Yeah, I would say that the most important thing is our solidarity and working together as a community and being in touch with people, particularly elderly people who may be quite isolated during this time, but generally checking on neighbors and friends and doing what we can in terms of favors or food deliveries or whatever to keep our communities safe and still practice social distancing. It's really the social fabric that's going to get us through this trying time. And I have every confidence the people of Seattle will meet the challenge.
Okay, thank you very much for that, Doctor. Denise, some final thoughts.
Yeah, I think the same. I mean, we have very smart people that are working in nonprofits right now who are providing services to our community. We have great, smart people who are working on what the health effects are. Our public education system has great teams built. We have school leaders that are really passionate, teachers who really want to do the right thing. And I just believe that at the end of the day, everybody in the city is going to pull together, and we're going to emerge stronger because we will have gone through it together.
All right. Thank you all for your input here, and we will be right back.
I'm out of work for at least 2 weeks, so I want my check.
I'm not scared of the coronavirus. I'm using the resources I have right now, which is the beautiful sun, and spending as much time as I can outside.
Keep praying that hopefully it's going to be okay.
We'd like to know what you think. Send us an email at contact@seattleichannel.org or find us on Facebook, Twitter, and Instagram. Before we close today, it's time for our weekly CIO poll. How have you been most impacted by the coronavirus crisis? Is it your health, employment issues, school closures, food access, or something else? We want to know what you think. Cast your vote and weigh in with your comments at our website, seattleichannel.org/cityinsideout. While you're there, you can watch our programs online anytime. We look forward to bringing you more coverage of the issues impacting all of us. Till next time, thanks for watching and stay safe.